you can't breathe, when you can't catch your breath. It's the worst feeling.
Coronavirus soars to new records.
She was just distraught and heartbroken because it happened so fast.
Challenging our front lines yet again.
So yeah, one more shift tonight, and then I'll finally have 3 nights off, which I'm really needing.
As the pandemic progresses, we're discovering new ways to protect each other.
I don't want to show fear, because I want the residents to know that everything's going to be okay.
We made it!
And finding different ways to cope with loss.
I think I'll look back and be like, I'm really glad I did that.
We're doing it all together, even though we're apart.
How long will we still be homebound?
At the end of the day, this will pass too.
This is COVID-19 in Georgia.
I'm Cheryl Preheim. Just today, the Georgia Department of Public Health reports 3,400 new cases of COVID-19. The number of deaths is trending back up. Hospitalizations are climbing. 11 Alive is dedicated to bringing you facts, not fear, when it comes to the coronavirus. And at a time when everything is constantly changing, Reveal investigator Rebecca Lindstrom is analyzing all of the data. She shows us where we stand in the battle against COVID-19.
When the governor eased restrictions at the end of April, the hope was that the warm summer months would ease our fears about the virus's return in the fall. Instead, July has brought a record number of COVID-19 cases and a new fight for life in our hospitals.
People are really wanting to go back to school. People are really wanting to go back to sports. People are really wanting to get back to normal. If we don't stop transmission of the virus, we're not going to get back to normal.
More than 131,000 people in Georgia have now tested positive for the virus. More than a third of those in the month of July alone. Certainly testing has increased this summer, but not at the same rate. And the age of those diagnosed has changed. These are the age groups, and the bars represent cases. Young people between the ages of 18 and 29 now represent the greatest share.
They're our most mobile members of society. They are also our risk takers, so they're more likely not to socially distance. The one thing that I want that age group to particularly know is they're not immune to the complications of COVID infection.
And those young adults, often asymptomatic, have already started to infect older people, many with risk factors like heart disease and diabetes, sending our loved ones to the hospital.
We just don't have the bed capacity to take care of the volume we're seeing.
On Thursday, Georgia Emergency Management reported more than 2,800 active patients. Now, it's not the highest number we've seen. In April, we had nearly 4,000 patients at one time. Doctors say only we, as a community, can prevent that from happening again.
You don't need to confront this virus. You can actually avoid it. It's not going to come up in a grocery to your house. It's going to come up because you're close to somebody who's infected.
The virus has shown no mercy to those working on the front line. More than 8,000 healthcare workers have been infected with the coronavirus. 58 have died. We have attacked hotspots for Latino and Hispanic families working in poultry plants and on farms. Health and economic disparities have increased hospitalization for Black people.
As much as everyone is doing right now, we need to do more.
Through it all, we have learned and learned together.
Multiple different ICUs, multiple doctors who never literally had met each other before are now texting each other and saying, I've seen this.
We've discovered the value of medications like remdesivir. Doctors are addressing blood clots sooner, using ventilators less and proning more.
It redistributes the weight of the lungs and it redistributes blood flow and can improve oxygenation.
There are more parades. The celebration is much for the medical staff as patients leave the ICU to finish their recovery. Still, the Department of Public Health says it verified 174 new COVID-19 related deaths this week. In Georgia, more than 3,000 have died in all. As you can see, the rate of death, along with all other indicators, is again trending up.
I know everyone's got COVID fatigue. I have COVID fatigue. So it's important, though, that we get up every day and realize that we still have to do our part.
In the midst of this crisis, many frontline medical workers have been forced to make the heartbreaking decision to live apart from their families. It is just another step healthcare professionals are taking to keep us all safe. Savannah Levins takes us inside their sacrifice.
15-month-old Zehra always runs to greet Dad after work, but never like this.
For me, coming up and seeing her running up, I was just trying to keep it together, to be honest.
Sam Shikali, an emergency physician, made the heartbreaking decision to separate from his family during this time to protect them from COVID-19.
I'm just one of many who are going through this.
The soldiers in this fight, doctors, nurses, paramedics, first responders, are answering the call of duty. It means tearful goodbyes to their babies. It means forgoing family dinners and warm embraces and goodnight kisses. It means celebrating milestone birthdays through a screen.
We had a virtual birthday party. It was really hard for a lot of reasons with our 1-year-old that we couldn't do the first one and couldn't do anything really much of for him. It was hard.
Every hello, every I miss you, every I love you.
Hi.
Distorted through a speaker.
You want kisses? I've been doing a lot of FaceTiming. Or even driving by the house and them waving out the window. I can't take the risk of bringing this disease home to them.
Hotel chains like Hilton and Marriott are pledging millions of free rooms to first responders. Airbnb committing to house 100,000.
We needed to find some place for him to stay, and he's been bumping from call rooms to hotel rooms. It's nice that we have an option now.
Pop-up groups like RVs for MDs are connecting people who have mobile homes with medical staff.
I feel like I'm called to do this, and I do take pride in it, but
in a world fallen ill, these moms, dads, daughters, sons answer the call, so you don't have to say goodbye to the people you love.
He does ask every day when I can come home, so that brings tears to my eyes.
And although every mile apart might feel like an ocean, a homecoming on the horizon in a safer, healthier world is something worth fighting for.
Now, more than ever, we're depending on our doctors and nurses to fight off an unpredictable virus. In March, New York City became the epicenter of the pandemic, in desperate need of help with overflowing ICUs. Georgia nurse Samantha Sansone answered that call, spending 8 weeks on the front lines of the battle. Matt Pearl follows her journey and the lessons learned from start to finish.
Okay, it is 5 days until I go off to New York to fight the COVID-19 crisis. This is my dog Cooper. I'll be leaving him and my fiance Brendan behind.
And I was actually talking with my patient's mom who also had COVID. She said her brain felt like mashed potatoes is how she described it. You're just in agony. So yes, I'm very afraid of that happening to me.
Today is, Monday, the 20th, and I will be flying out tomorrow at 4:30 p.m. So I'm excited and I'm scared. So it's midnight. I finally sat down. I got put on a med-surg unit, and I have 5 COVID patients. We had one patient that was not mine, coded.
They were about to intubate the patient, and he did not make it. And that was on my first shift, and I just thought the rest of my shifts were going to be like this. The body rolled by on the stretcher to go to the morgue, and you just think like, that's just joining all the other bodies down there. They don't have enough room in our morgue. It's not normal. All these people are dying alone and dying without, a hand to hold. I contacted my uncle the other day because he owns a car dealership, and he said I can lend you a car. He said, okay, a driver will be here tomorrow at 2 o'clock. It's my 2 cousins in the front seat, and my uncle comes around the corner. I drop to the floor crying. I love you guys. Because after like 5 days of, you know, seeing all this bad stuff, they were there and oh, sorry. They were there.
Can we give a hug?
Finally, my uncle's like, can we just hug you? And I was like, yeah, screw it, hug me.
Oh, I love you guys so much. So good to see you.
I definitely feel like I'm where I need to be.
So we just got to discharge a patient home and everybody clapped for her. There's just a little bit of happiness in all of this. It's pretty cool to see positive in all this darkness.
This job is a lot more mentally draining. We don't know 100% what can cure this or fix this, which is hard because I want to instantly fix it and make them feel better right away, and I can't do that. So it's definitely straining.
So I have one more week until I get to go home. So that's 4 more shifts. I am packing up the last of my stuff.
I'm the last traveler on the unit who has been there since day one. All the people that's their home unit, they're taking this time off because they were working so hard before we got there. I kind of feel selfish. Like I get to go home to my family and my life. Some of these people were totally fine until they weren't. Some of these people were in great health. I think we should probably be more careful than we're being, but at the same time, people are wanting their sanity back and wanting to have social events back because that's what makes us human.
Home at last. I'm back with my dad.
I'm so happy. Hey, dude.
At the end of the day, although I'm so happy to be home, I'm also so grateful that I was able to have this experience and to feel like I impacted the world and people's lives, as well as them impacting mine.
In the midst of so much sadness, they are the hope. How hospital heroes going above and beyond in our time of need. Nurses and doctors are leading the fight against coronavirus, but hospitals are filled with unheralded heroes also helping. They lift us up in moments of question and help us hold together when we're falling apart. These are the unseen faces truly making a difference.
When you say healthcare worker, that's not somebody that works just in the medical field. The carpenters, the environmental services, security, I mean, the list just goes on and on. My name is Jeff Rohde, and I'm a multimedia specialist at Holy Name Medical Center.
And I don't know how you're all feeling about this. My name is Brian Quinn, and I've been doing this chaplaincy work for 34 years at Medical City, Dallas. But what you do is very close to the heart of God.
My name is Mike Hodges. I'm the Director of Public Safety at Piedmont Athens Regional. The hospital, pre-COVID, is a very open and welcoming place, and we like it that way. We want families to come and go.
I think that early on, we didn't understand just how big this would grow. The beds would just fill up. It was tough to see. It was tough to see that how many patients were coming in. I don't know if I ever really thought about if I had to document patients and document our staff here at the hospital. I think I wanted to. There were a couple moments when nurses were going to enter a room with a COVID positive patient. They would take a moment before going into the room.
We're in this together. We're in it together. The burden for me, for hospital staff, has been this thing called compassion fatigue. When you go home at nights and you feel you have nothing left to give and you start to question why, trying to remind the staff that they need to take care of themselves, because an unbalanced wheel will wear out the quickest.
Most people, they probably look at hospital public safety and think, have a picture of a security guard sitting on a bench somewhere watching the crowd go by. You're dealing with the full range of human emotions in a hospital. To be able to enter into someone's worst day and someone's worst moment and help de-escalate and calm. If there's an issue in a room, the officer's going to go in as well and be there in that environment. You know, that weighs on individuals. calls.
One of the nurses was called over to a patient who was on oxygen and he was unconscious and he had taken a turn for the worse. The nurses were just holding his hand and talking to him. I saw some of the most compassionate care that I've ever seen. And it was with somebody that could potentially get them sick. You'd have doctors and nurses calling in on their days off. They would come in on the day off to do a clap out. How dedicated medical workers are. It's like a different type of person.
Working 12 hours in a COVID unit, the stress, the tension, the fears, the feelings, and to see their courage and compassion in light of the storm has been quite remarkable.
Right now, things have slowed down quite a bit. We're in single digits with COVID patients. And what I've been doing is following the rehabilitation of patients at home. They couldn't even talk when the tube was taken out. So it's great to see after so many weeks of seeing a lot of sickness.
You certainly know about the nurses that put themselves in harm's way, or the physicians coming in and out. We're all in this together, which can be kind of a hokey phrase at this point, but it's true. What's been caused me to be so proud is just seeing that complete lack of hesitation, that commitment to the role that the job that they have.
I confess to you, it's a choice that as caregivers and as chaplains, we have to choose every day. We have to choose hope. We may have been called in the night before to work a death, but we have to choose that day, hope, because hope is an amazing thing. I couldn't do this if I didn't have the hope that there is always something better to come.
I can't speak highly enough to all medical professionals that went to work to help patients through this. Everybody just pulled it together and supported each other and made it work.
They are more than just a number. They're survivors. Meet the people who face COVID and hear their advice for all of us. Health departments don't track the number of people who survive COVID-19, so their stories are hard to tell. But hundreds of thousands of people have recovered from the deadly virus. We talked with dozens who've made it through and asked, what do they want us to know about the virus?
We represent people that have a story to tell. My name is David Jameson.
My name is Amanda Trejo.
Marissa Liuzzi.
Scott Schuback.
And I am a recovered COVID-19 patient.
I was a patient in an intensive care unit.
I've just recovered.
Out of the 12, there was about 8 of us that were affected.
I'm still having issues. I'm still having issues sleeping, still having issues with anxiety.
When I walk up the stairs from the parking lot to the entrance and I'm carrying a briefcase or some papers, I have to slow down.
We've been just really trying to just stay away from everyone and only leaving the house to give plasma.
My aunt was positive for COVID-19 and was admitted to the ICU. I went and donated my plasma. Within about the next 11 days, she was able to come off the ventilator.
Everything that we can do to possibly help save a life is something that people need to start really looking into.
I truly believe that maybe I got COVID-19 so I could save not only my aunt, but a stranger as well.
This situation has taught me that we should never, ever take anything for granted.
For whatever reason I'm here, it is upon me to become a better person. As a physician, a father, a husband, that is upon me to become better.
I think this is a trying time.
We have a happy ending, fortunately for us.
It would be a waste for a person to go through something and not inspire someone else who's going through the same thing.
For all of us here at 11 Alive, thank you for joining us tonight. You can find the latest information anytime on 11alive.com/coronavirus. And there you'll find an interactive map with county by county breakdowns, the latest on back to school plans by district, and new details on vaccine trials, unemployment information, and of course, the many stories of hope.